Hi, I'm Rachel Royser, founder of Explore Neuro, and today I'm here with Dr. Peri Seshens, owner of Bridge Kids, a company that provides behavioral therapy to children with autism and other related disorders in New York. Thank you so much for being here.
Of course.
So to start off, I wanted to ask, what made you decide to go into your profession as an applied behavior analyst, and what does a certification in ABA allow you to do?
So I always loved working with children, so I knew I wanted to be somewhere in the field where I could work with kids. I one summer had, worked at a camp for children with special needs, and I had a couple of children with autism that I worked with, and I had a wonderful summer getting to know them, and I really enjoyed it. So that sort of steered me along the path, the psychology path, for my undergrad and for graduate school. And then I just had various internships where I was sort of continuing to be exposed to that population. And one of my jobs was working in a school for children with autism where they utilize applied behavior analysis, or ABA. And I loved what I was doing. So I continued to just pursue additional certifications and licenses in applied behavior analysis.
Mhm. So then once you get your certification, what kinds of jobs do you get that are connected to ABA?
So usually the certification is a board certified behavior analyst, or BCBA. So generally that qualifies you usually as an expert in applied behavior analysis. So BCBAs can do lots of different things. I would say probably the most popular, for lack of a better word, job that a lot of BCBAs would get is probably working with children with autism, providing direct therapy or providing supervision for other more junior therapists that are providing ABA therapy to clients. But BCBAs are well versed in the in learning theory and the application of behavioral principles across lots of different areas. So, I know some BCBAs that, work in industrial organizational psychology and, utilizing behavioral principles with management in larger organizations. BCBAs can also do, other jobs related to working with children, whereas it's working in a school or more administrative type positions with, school oversight, running agencies that provide direct therapy to children. I think the jobs are quite endless. I think the use of those skills is applicable to lots of different areas.
So then if you are working in the field where you're working with children with special needs and you have a new patient, what do you discuss in your initial consultation, and what kind of evaluations do you do?
So for my specific company, Bridge Kids, we provide comprehensive evaluations, but then we can also do initial consults for families who are coming to us for services who have already been evaluated. So if a family is coming to us for the first time and has never had an evaluation, and the parent has a question as to whether the child has any sort of diagnosis, we can do a comprehensive evaluation, which would involve, various cognitive assessments or IQ testing, achievement assessments, or any adaptive assessment, just to get a really strong picture of the child's functioning level, what their current needs are, and then to determine if there's any sort of a diagnosis that needs to be identified. For a family that has already been diagnosed and is coming to us looking for specific types of services, an initial consult is really a way just to get to know the child and to determine what the goals of the family are. So it usually involves doing a parent interview and then doing an observation and a short interaction with the child, just to really get an idea of what their current skill set is, and what the family is looking for with regards to therapy, and then to determining what that potential treatment package would look like. Once we start with the child, then we would do a more in-depth assessment where we utilize more standardized assessment tools to determine the child's strengths and weaknesses, and use that information to develop more specific treatment goals and programming for them.
So would one of those, I saw on your website, functional behavior assessment, so what would that entail?
So a functional behavior assessment, or an FBA, the goal of that is to determine the function of the behavior or the reason why the behavior is occurring. So an FBA usually occurs, we would usually administer an FBA when a child is engaging in some sort of challenging behavior that is either significantly interfering with their learning, the learning of others around them, their safety, the safety of others around them, or just their overall independence in their daily life. So we use that assessment as a way to dig really deep into these specific behaviors to determine why they're happening. And we gather lots of data throughout the process of the assessment. And then we use that information to determine the function of the behavior. And then once we know that, we can use that to develop a very specific behavior intervention plan with the overall goal of decreasing that challenging behavior while also teaching the child appropriate replacement skills to replace the more challenging behaviors.
So then when you're teaching these skills, how do your services impact children in their education, like skills that are necessary for the classroom and for social skills and stuff like that?
So, we work with children both in their school and in their home setting. So we have more of a direct impact when we're pushing into the schools. We have a lot of clients that do require more intensive direct ABA therapy in order to learn. So in those situations, we will go with the student into the school and work one-on-one with them in their classroom. So there we obviously have a direct impact on their education because we're utilizing different strategies to, one, manage their challenging behavior so that they can sit and attend to the classroom. So we're teaching them the skills that they need to be more available for learning so that they can actually sit and access the education that's being provided to them. And then on another level, we also work with the teachers and collaborate with them closely to help them break down the skills into smaller components and show them how to directly teach the students. So, a lot of our learners learn a little bit differently, and some of them need different strategies in order to learn new skills, or need skills broken down into certain ways for them to be able to learn them. So part of our programming is teaching the child in a way that they can learn and working with the teachers to help them also teach the child in a way that they can learn. For the students where we only see them in the home environment, we have a lot of collaboration and communication with the school. But we're working on providing them with an extension of their school day, because a lot of the students that we work with require extensive repetition, and they need that additional learning time in order to acquire skills in the same way that a typical developing child would. And then in the home, we also then provide them with other we also teach them other skills that are necessary for their home environment that basically can get them to school in the morning. So working on activities of daily living, teaching them how to get themselves up in the morning and get ready for school, take care of basic needs, working on toileting, which of course carries over into the school, basic hygiene. The skills are endless. And then of course, any social skills that we're working on would also carry over into the school because we're teaching them sort of how to engage and interact with others.
So then on top of working with other teachers and helping them in their home life, how do you incorporate parents into therapy, and why is that important?
So incorporating parents into therapy is extremely important. It's one of our top goals with any family that we work with. And as a company, we actually have a rule that parents are required to participate in parent training, or we won't work with the family. And that's because, any behavior change is not going to be significant unless the child is emitting those behaviors across environments and across people. So, we can teach a child a new skill, but if they're only engaging in that skill with us as therapists, then what value is that skill to them if they're not using it with their parents or with other people that they're exposed to? So, anything that we work on with a child is extremely important that we have the caregivers follow similar protocols so that the child can also express those skills when they're with the parent. We often have situations where the child will engage in will present with certain skills with us, but then we don't see that with the parent, and then we feel like we're doing a disservice to the child. So we require that parents participate in weekly parent training, and the parent training is structured a little bit differently based on the parents' skill set, the parents' availability, and then of course what the child's needs are. But that's always a major component of our therapy.
Yeah, that makes a lot of sense, so that it's more well-rounded and in all areas of life. So I guess kind of going back to when you're first diagnosing and meeting with children, why is early intervention so important when working with kids with special needs, and specifically kids with autism spectrum disorder?
Yes, early intervention is very important. There's actually tons of research out there that shows that the earlier you intervene, the better. And that's why New York State actually has the early intervention program that's funded by the Department of Health, because there's so much research that shows that it's effective. And that's because when kids are young, their brains are still developing. Their brains are really malleable. So there's so much, the child is going to get so much more out of their therapy at a younger age because that brain is still developing and it's making more connections as you teach them things. And the research shows that the earlier you intervene, the better the outcome. So early intervention is huge in New York City, and it's completely funded. And I think that's great because it's not the same in other states. And I actually used to be the director of an early intervention ABA program before I, was running Bridge Kids. And, we serviced kids, around 2 to 3 years old that were very newly diagnosed. And you can see the impact that the therapy has on them. It's quite amazing. And, the earlier you start, the better you're going to see the outcomes. And it also creates a situation where you're not going to see this long learning history of inappropriate behaviors. If we start with a client, for example, that's much later in life and was not, for example, say the child is 10 years old and they hadn't received therapy yet, we're now combating with 10 years of learning history of, that we now need to break. And also we've had working with a child who had 10 years lost where they could have been developing all these skills and we could have just been advancing them and working on them sooner, and we're almost starting from the beginning at that age. So I'm a huge proponent of early intervention, and I'm a huge proponent of pediatricians who recommend families for early intervention right away, because I think there's no harm in starting earlier, or at least having someone do an evaluation to determine if anything is needed, because again, the research consistently shows earlier is always better.
Yeah, so then for early intervention to happen, the parents wouldn't probably suspect something. So, at what age do you typically see that children are suspected with ASD, and when do they usually get diagnosed?
I think it varies. I don't know the statistics on that. I can speak from my personal experience, having been someone who worked in early intervention. I am a licensed psychologist as well, so I am trained to diagnose autism as well. So when I was working in early intervention, of course, all the evaluations that I was doing were for children who are around age 2 to 3 years old. Usually, I would say in general, in my personal experience, I think parents start to notice that something is wrong when the child's not speaking. That's usually a red flag to most parents that something doesn't seem right and that they should seek out an evaluation. For children who have autism who are much higher functioning, sometimes parents don't seek out evaluations until a little bit later because perhaps the child is verbal, but some of their delays or their social delays are not coming out until they're in school. So those children, families may start to, seek an evaluation or notice that maybe something is off when the child is more around 5 years old, when they're beginning formal schooling. So it really does vary. Again, the hope is they're getting evaluated more around the age of 2 years old, but I can tell you that we've had families come for evaluations where the child is older than that.
Yeah. So you were saying that a common red flag is delayed speech. So are there other types of diagnoses that come along with autism spectrum disorder apart from speech disorders?
Yeah, so autism is comorbid with various other diagnoses. You will commonly see some sort of a speech delay. But, we work with a lot of children who also have other types of anxiety disorders, for example, OCD or any sort of generalized anxiety disorder. You sometimes will see it comorbid with attention deficit hyperactivity disorder. So that does generally happen. A lot of the learners that we work with present with some kind of motor delay or motor planning issues. So, there's a lot of different presentations that we see, and it varies significantly across children.
Yeah, so then once you're working with the kids with applied behavioral analysis, do you also recommend things like occupational therapy and speech therapy?
Yes. If we do, we're experts in behavior, but there's certain skills that I'm not trained to teach. And I think a good ABA therapist knows their weaknesses. And, we work in conjunction with with therapists in other areas. And we're lucky to have, we have actually a lot of therapists that work for us that are duly certified or duly licensed. So, my business partner, the other owner of Bridge Kids, is a licensed speech therapist and a board certified behavioral analyst. So she can actually provide speech therapy, but utilize her behavioral skills to create a more productive speech therapy session. But we've worked in the past with, and I currently work a lot with occupational therapists. And, there's a lot of skills that I'm just not trained to teach. So if we see weaknesses in certain areas, fine motor skills, gross motor skills, we may bring this up to the parent and recommend that they have the child evaluated, potentially seek those additional services. But in general, usually when the child comes to us, they're usually already receiving those types of services. So it's just our job to communicate with those service providers and to make sure that we can carry over things across our sessions or provide them with behavioral strategies that we know work with the child to make their sessions more productive.
So then when you're working with a child and there's like a team around that child too, and you're tracking the progress of the child, how do you track progress? And then do you communicate with their other therapists to see other areas that they're working on?
So we take a lot of data in ABA. That's one of the things that's how we know that ABA is so effective, because we take data on what we do and we make decisions based on that data. Nothing that we do is arbitrary. We do assessments, we determine what the goals are based on that. We take daily data, and then that's what drives our decision making. So we take lots of different data, and it really depends on the child that we're working with and the programming that we're addressing. So if we're tracking some sort of challenging behavior, we may be taking frequency data on that, or duration, how long is the behavior occurring? It really varies significantly across clients, but whatever data we take, we're graphing that data. So we always have like visual displays of how the child is performing, so we can make really objective decisions about the next steps. And when needed, that data is always shared with service providers and families so that they have that information to help guide their treatment as well.
Yeah, so then with that data, you're able to see how they're progressing and also if they're improving.
Mm-hmm. Yeah, so we use that information to determine how they're doing, and if maybe the data is showing us that the child is not learning, and that's a signal to us that something that we're doing isn't working. So now we need to make a change to our treatment plan in order to ensure that the child is learning. So we're never going to proceed with something that is not where the child is not demonstrating to be learning or making progress.
Mm-hmm. So then also, as the child ages, how do children's needs tend to change over time as they get older?
So our goals definitely shift as the child gets older, because the focus starts to change. When the child is really young, we're looking very heavily at communication skills all of the time. When a child is younger, the communication skills are a little bit different than maybe the ones that we're looking at when they're older. But, we're also focusing more on school readiness skills, pre-academics, stuff like that, to help them learn at school. As they start to get older, the academics start to become a little bit less important, and life skills start to become more important. So we're starting to look at, well, where is this child going to be in 10 years? Where are they going to be living? What skills do they need to help them be the most independent in their daily life? So as they become a teenager, we may start focusing much more heavily on activities of daily living, on vocational skills, things that they can do to be more independent, and really focus on like what the next 10 to 20 years of their life is going to be, and the skills that they're going to need to be the most independent and the most successful in whatever environment they're going to be in. So there's definitely a huge shift as the child, gets older and starts to move into, the double digits, like teenage years.
Yeah. So then is there an age cutoff for the children you work with? And once a child outgrows your services, where do they go for additional support?
So we don't have an age that we cut off services. I think currently our oldest client is around 25. So it, really depends on the types of services that the client is seeing. For those who are receiving our services that are funded through, the Department of Education Impartial Hearing Office, those services get cut off when the child is 21. So, it's really more of the funding source. So in that particular situation, the family would move on from our services, and depending on the child's functioning level, they may go into residential treatment, they may live with their parents, they may go to college. It really depends. Our clients, their functional levels vary so significantly that it's really hard to say. But we will continue to work with clients past the age of 21 as long as we have functional goals to address. We'll continue to do that if the services are needed.
Yeah. So then, do these skills also help once they go through college and also with trying to get jobs as well?
Yeah, so there's so many skills involved in just the process of even trying to find a job. I mean, you think about the social skills needed for interviews, creating resumes. There's so much involved in getting, someone ready for potentially looking for a job, and then also training them on how to perform that job. So as I said, like ABA therapy we're just talking about behavior change in general. So we can basically be teaching anything. So as they get older, we just modify the goals that we're focusing on and continue to focus on, and continue to build on the skills that we've previously taught them.
Yeah. So then, to kind of like implement those skills into daily life, do you give like homework assignments or kind of like daily activities to follow?
It really depends. For our lower functioning clients, that would be usually they require us to be there in order to provide that therapy. We do have clients that we work with that perhaps don't have a diagnosis of autism. Maybe we're addressing more clients with ADHD or anxiety. That's more of our psychologists work with those clients. They may have some homework where, we do some things in session and they're required to practice them on their own. But I would say for the majority of our clients, usually homework is not provided because for many of them, they would require some direct therapy with us in order to do that. We will place assignments on parents. So sometimes we'll say, this is what we're working on in our session. We want you to do this, this, and this over the weekend. So something like that may happen and we would follow up. But in general, I would say homework is probably more of a strategy used with our higher functioning clients who are able to engage in the activities independently.
So I guess towards a different topic, I read on your website that you traveled internationally to provide professional training and create special education programs in Vietnam. So I was wondering if you could talk a little bit about that experience.
Yeah, that was a wonderful experience. I was recruited to go there through my graduate program where I got my doctorate degree, St. John's University. And they have a great relationship with a school over in Vietnam. And one of the students in Vietnam did have some special needs, but they really didn't have the education or resources to be able to provide that student with support or any other students that potentially needed it. So they recruited a group of us, I think it was about 7 professionals, and we all went over to Vietnam and we did a lot of, there's a lot of press around it. We did some trainings, and then we worked with some of the teachers there to help train them on how to work with some of these students. We were only there for 2 weeks. So the experience was great, and we were able to really open everyone's eyes to the special education field and different strategies that can be utilized. In the end, our recommendation was for them to hire a person that can oversee the program and to train them. I would have loved to be able to go back and follow up on that, but unfortunately, it was only a 2-week period. But it was a really great experience. And I think they learned a lot about, the world of special education and hopefully got access to some resources that they would have never had access to had we not gone there.
Yeah, that's so cool that you were able to travel for it.
It was
Did you learn anything from that experience?
I learned behavior is behavior, which is something that I always knew, but having to experience it it seemed like a completely different world. They didn't speak the language. We had to work a lot through translators, but in the end, the principles were the same. The way I would teach behavior change here in New York was the same that I was teaching behavior change in Vietnam, even though they didn't speak my language, which I just thought was incredible to experience and to see that.
Yeah. So what kind of advice would you give to caregivers and families who are looking for help for their children or starting to get therapy for their kids?
Mm-hmm. For those who are questioning whether they need help or not, my advice is seek it out. The worst that could happen is that someone could turn around and say, I don't think your child really needs support right now. And that would be great news to hear. But if they do need support, as I've said before, the earlier, the better. So, for those parents who are questioning something's wrong, if they have a 2-year-old, my recommendation is to go to early intervention, get a free evaluation, and see if your child needs help, because the earlier you do that, the better the outcome is going to be for your child. That's my first suggestion for parents. And for those who have older children who are getting therapy, my recommendation would be to get involved, know your therapist, know what they're doing, and know what good therapy looks like, and make sure that your child is receiving the therapy that they should be getting. I think in our field, there's a lot of wonderful therapists, but there are also some that perhaps need a little bit more training and support. And I want parents to make sure that they know what therapy is supposed to look like, and they're contacting reputable companies that can provide therapists that have really good training so that their child is getting services that are appropriate. And also, my third piece of advice is for parents to know their rights and to make sure that when they're in this public school, if their child is in public school, what their child is entitled to, and to make sure that their child is getting that. And if their child is not getting that, they need to be a very strong advocate for them and try to fight for more. And if they feel that the school is not able to provide that, to seek out legal assistance to make sure that their child gets it. Because the more years that go on that their child is not getting support, they're losing all these learning opportunities that could really, really be helping their child. So I urge parents to just be the best advocates that they can for their child, and to stay as involved as they can, and just make sure that their child is getting what they need.
Yeah, I mean, the importance of self-advocacy, like on the parent side for their children, has been something that I've learned a lot about through doing the interviews and learning about parents' experiences with their kids, and how much work gets put into advocating for their kids to make sure that they're getting the education and the accommodations that they need.
Yeah. And seeking out support from professionals if you're not sure.
Mhm.
We have a lot of families that contact us and say they don't really have a lot of information, but they're like, I was told to call you. Can you just help me? And I'll sit on the phone with them for a half hour and just talk them through what they should do. And it just empowers them. I want parents to know that they're in control, and they can control their child's destiny by just being there and seeking out information and learning where to go, and that there's so many wonderful professionals out there that can help. And I want parents to just feel empowered to be able to do that.
Mhm. So to conclude with my last question, do you have any major success stories, or one of the best moments or most memorable moments of your career?
Oh, that's a really good question. I don't know that I have one moment that stands out. I think a lot of the years earlier in my profession are ones that stand out to me a little bit more, because those are the moments where I realize I'm in the right place, and this is what I want to do. That light bulb moment when you say, oh, this is what I'm meant to do. I had a lot of that when I was younger, and I was first dabbling in the field, and had my first job working in an ABA school, and started working with clients, and they're so little, they're 2 years old, and just seeing the impact that it had on all those students. I think that has really been the foundation for what I've chosen to do for the rest of my life. I started my own business around that, because it had such a significant impact on me, and I saw the significant impact it had on the family. So I don't know that I could identify one moment, but I think in general, just that time in my life when I first started working in that ABA school, when I was in my 20s, and I was still figuring stuff out. That's probably what stands out to me the most.
Mhm. So thank you so much for joining me today and speaking about applied behavior analysis. And everything you spoke about was really interesting and informative for parents and others hoping to learn more. So thank you for your time.
Of course, I'm happy to do it.